You're listening to Autism Compass, your guide to navigating the complicated, intricate, fascinating world of childhood autism. I'm your host, Amy Tandiko. Together, we can navigate the confusing process of autism diagnosis and treatment. Let's talk about it. Hello, and welcome to the Autism Compass podcast. I'm your host, Amy Tandiko, and together, we're going to explore resources and pathways to help your child with autism. I'm located in Calgary, Alberta, so many of our resources will be Canadian or local to Alberta. However, our conversations, ideas, and online resources will definitely be applicable to anyone listening. Today, we're going to have a conversation with Hilary Dinning from Marda Loop Naturopathic and Wellness Clinic in Alberta, specifically in Calgary, Alberta, where we live. Hilary is a warm, loving, welcoming doctor of naturopathic medicine, and she specializes in pediatric health and development, as well as neurodivergent support and care. Hilary, welcome to the podcast.
Thank you so much, and I'm so happy to be here.
Yeah, maybe you can begin, Hilary, by just telling us a little bit about your education, but also I believe that you are the president of the Alberta Association of Naturopathic Doctors. Can you tell us a little bit about that as well?
Do you know what? Actually, this was a bit of a second career for me. And what I mean by that is that I went back to school in my second degree, meaning Doctor of Naturopathic Medicine, at about 30. And so I did that at the Canadian College of Naturopathic Medicine, CCNM in Toronto. That's a 4-year program. And you can, if you, more so actually in the United States, you can go on and do specific programs after that education itself. However, in my 4 years there, my last year, I did a focus in pediatric medicine. So that sort of led me into where my focus is obviously today, and that my interests have led me into that further focus of neurodivergence, chronic conditions in pediatrics, and really like working with the entire population. My position at it's called the Alberta Association of Naturopathic Doctors. So we represent the naturopathic doctors in Alberta. And one of the main focuses that, well, you know what? How I got into it was that it was during COVID, and we were in those early days where, my goodness, like, no, we were all like, oh my goodness, what is going on?
Yeah.
And we were shut down. And to be honest, I can't remember if it was like 3 weeks or 6 weeks, yet we weren't able to provide care for new patients. We were for current patients, not able to provide new patients information about how naturopathic medicine can support them, maybe, with a COVID virus, yet also with comorbidities. So lots of patients were coming in and saying, or calling in saying, we need help. And I thought, my goodness, we can help. So let us. So then that's how I got into becoming a part of the association and the board, and then specifically into then government relations.
Okay.
And then what we're working on right now is to lots of conversations with government and current MLAs to explain or to provide information on how naturopathic medicine can play a role in the Alberta healthcare system. And I think the word collaboration is actually quite key to our topic today of autism and all aspects around it, because how can we collaborate with the rest of the Alberta healthcare professions to say, hey, we're here, this is how we can help the healthcare system in general right now, and this is how we can help patients. So what we're doing is we are wanting to gain access to net care, for example. We are here to administer vaccinations. We are looking for prescribing rights. And what that does is it relieves burden on the healthcare system if patients can come to us to get support versus, in the emerge room or in your GP's office that has a definite backload in patients.
Wow, that's interesting. I had no idea that was an initiative. I absolutely love that. That's actually a little bit on our list later on, is to talk about some of those things. So that's amazing. And what a win that would be for families to be able to access, especially a lot of families are leaning more and more into more, a holistic approach, a more natural approach, a more integrated or like collaborative approach, like you were saying. And it's just not necessarily easy to access. And as a lot of, like me, for example, or a lot of families, we just don't know a lot about it because it's not how we were raised and what we grew up in. And so the access to that care would just be fantastic. Wow. Yeah. Yeah, I love that. You mentioned that, you ended up kind of having a passion for pediatric care. So, and maybe even for neurodivergence or kids on the spectrum, like what sort of led you to head down that road?
I think that, and that's such a great question. I think it's interesting what you attract and then what's attracted to you. I think that pediatric care, that was always a huge piece of my passion, was because I feel so strongly that at a young age, if we can really interject or support, I should say, that going forward in their adult life, we can prevent so many ailments to occur. Mm-hmm. So that was my sort of passion for pediatric medicine in general, to really start young and nurture and support them young.
I love that. Yeah.
With the neurodivergence piece, it is figuring out complex cases, because there are so many moving parts to a child with autism. Mm-hmm. That really drew me to that. And the second piece is that in and amongst, how we have these labels of autism and we've got these diagnoses and they're potentially throughout as a parent. There's lots of mourning to do with, or grieving to do with, oh gosh, this is a harder road. In and amongst that, what I feel drawn to is that children with autism, and I am speaking very broadly, aren't I? Children with autism have this incredible ability to have this sort of sixth sense and to have this incredible sort of vibrant personality that's oftentimes locked up inside. And so I have this sort of, I'm drawn to wanting so badly to support that little being inside, yet also to just bring it to light in and amongst society, right? Mm. And breaking down, and we can go through sort of what parts to identify and to understand, whether it be to understand root causes to these symptoms that present, or whether it be to support different body systems. We can, walk through that. There's that complex piece. And then there's just this drawing to these tiny little vibrant human beings, I feel like.
Oh, that's so nice. That makes me love you even more. Glad that you're on our team, because I know we talk about that all the time. Like what's deeper inside our kids that, they can't get out right now because they're struggling with communication, or they're struggling with regulation, or whatever it might be, or if their digestion isn't working right, it affects everything else. And so how can we dig deeper and know our children more and know more about them and better be able to support them? And it's life-changing and honestly, like, invaluable to have people that see it that way on your team, as opposed to, you hear many parents say like, oh, my doctor just told me, go find a therapist, or go, like without that deeper level of care, which isn't all doctors, obviously, but we know that it happens sometimes. And so that's special. That's wonderful. So thank you for that.
And what I would say too is it's, and I'm generalizing when I say this, yet it's, it's, our Alberta healthcare system is overrun, right? And so, you head to a GP's office, and it may, no, I'm not saying that it's not their fault. That's not maybe the right way to say it. Yet it's like they're so inundated, right? And their time is so sort of to the minute that coming to a naturopath as well as getting support from a GP is such an incredible fit, because it can be so complementary, right?
Right. And I mean, I know we've found we love our doctors and we feel like we have a great support system, but we also find care can be general at times. There's not always enough time and enough energy and resources to make sure that
Right.
care is specific for our child instead of just autistic kids as an umbrella. So you're absolutely right about that. And along those same lines then, so like looking at complementary therapies, like what do you feel like a naturopath offers, or what can a naturopath offer that's different or complementary to like my pediatrician or, someone in Edmonton or wherever they happen to be, like their family doctor? What can you come alongside them and offer them that maybe they wouldn't be getting at their regular doctor?
Yeah, and that's a great question, and I feel like that's where my passion. I'm like, ooh, I get so excited about this, because really, and I'm going to say we, meaning naturopathics and doctors in general, what are one of the sort of foundation or pillars of naturopathic medicine is to look at the whole person. There are many factors playing a role in how they phenotypically show up. And so we want to understand all body systems and how they're working together to understand the root cause to any symptom or sort of set of symptoms that are presenting. When we think about autism spectrum is such a wide spectrum, right? So let's just say, let's give an example of, a child comes in and presents with nonverbal communication or lack of communication in general with the outside world. Let's say, poor slate quality and head banging, or other sort of negative, not negative yet repetitive behaviors or stim behaviors. What we want to do is, I think to myself, okay, I want to explore body systems. I want to understand the gut, because the gut then affects the brain so much, not only on neurotransmitter production, yet how the neurons are developed and inflammation or lack thereof. I want to understand detox pathways, because oftentimes, and not always, there's a genetic makeup that then allows enzymes to not work properly to detox the system fully. Or we have a child with autism that actually is just very exposed to toxins that may affect that child differently than the next child over, given the genetic makeup. Okay, so we want to understand lifestyle exposures, etc. We want to understand, and this is more on the physical level or continuing on the physical level yet, mitochondrial function. We want to understand methylation, which runs over, 400 different enzymes in our body. So nervous system, digestion, immune system, not only do we want to understand this, like I was saying before, to navigate how to support the child, yet also to understand, is there a root cause to this piece that we really want to get at and dig at and treat in order to then really alleviate symptoms that are presenting. So, and that I would say is, we're talking about the physical level, right? The next piece to this is where naturopathic medicine can provide support is, lifestyle learning tools, and this is what I said even before we started recording yet, to say, okay, we can not necessarily offer you, yet also then refer you to these people on your team that would really support your child going forward, whether it be a speech language pathologist that works with this type of child. Here are resources with respect to, devices that are really helpful in learning, and this is what you can do at home. So my point is that even if it's not me giving direct care, I can say, okay, you know what? These are the times that I feel like we need to look to other pieces. And the last thing I'll say, because I can hear myself going on about this yet, is two things. Sorry, Amy. One is the mental emotional state that, I guess plays a role on their nervous system, yet that mental emotional state, not only of the child, yet really supporting the whole family. It affects so much in terms of what goes on with the family. Last thing I'll say that I feel like is like a little sort of sidebar or a side note where naturopathic medicine can really shine. And specifically in my practice, I guess I should say, because I shouldn't probably speak for everyone, and that actually goes along with that little being, the essence or the brightness inside of each of those children, and the energetic component behind it. And that's another piece where I will, in and amongst my treatment plans, I will then say, okay, you know what? Let's look at this little piece and how what's going on with them from almost like an essence perspective, and how can we support that?
Yeah, and that's another whole interesting. We should just have a whole episode on that one day. But I know that you love to look at that, like literally like the spirituality part of who your clients are. And that's special as a parent, that somebody looks at them with such a unique eye and cares about that piece and the health of an individual's spirituality. And I love that too. So yeah, it's a good point to touch on. We'll have to have a whole talk about that one day.
So when I kind of go through all the body systems, the physical and mental, emotional, lifestyle, family, resources, putting all of that together and then bringing in other practitioners if need be, it can then, the sort of culminating in here's a plan going forward, and here are steps that we're going to take along the way.
Right.
And I think that's sort of when you asked me your initial question of, how does naturopathic medicine fit in? It's like we can be what's the right word, Amy?
Yeah, almost like a good foundational piece, really, I think. Yeah. Well, but with all that said, not every naturopath on every corner is necessarily going to be the best fit for a family who's struggling with an autism diagnosis or potential diagnosis or a symptom picture. So if I'm a family who doesn't live near Marda Loop and I can't come see you, who do we look for? What credentials do we look for? How do we know that, this specific naturopath is going to be a great fit for our family?
That's such a great question, because I imagine that it can be very overwhelming, right? To say who is the right fit and what do I even look for?
Right.
So what I would say is in naturopathic medicine, we can't say the word specialize. You can say the word focus. You would look in naturopaths' bios of what their focus areas are.
Okay.
And so you would understand obviously information from that, whether it be pediatrics or whether it be specifically in neurodivergence. I'm saying that sort of as an umbrella. The next piece is there is a it's called PEDNAP, and it's called Pediatric Association of Naturopathic Physicians. Maybe we'll connect this, the webpage to this afterwards.
Sure, yeah.
That's another piece where you can look into pediatric-focused naturopaths.
Okay.
So that you'll understand where you're living and then who's in my area. I think that is I think where to start. Then look at the bios and see what resonates. And then the last thing that I would say is that many naturopaths offer a little free consultation to just a welcoming, or sorry, not a welcoming yet, a introduction, and actually utilizing that and really hopping on and saying, listen, this is where we're at. This is where my child is at. And if it's not you, who else would be a good resource?
Right.
Yeah.
Yeah.
And I think that's huge because I would say, or you hope that in the majority of people, it's like, you know what, this isn't a good fit. However, I know who. And so that's where it's like digging around to really find that naturopath.
Wow, that's great advice. And those are resources I didn't even know about. So we will definitely link those in and include those for families. I really appreciate that thorough answer. So for us, for our family, actually, we stumbled, Lane, my older daughter, stumbled across your website looking for guests for this podcast and came across you. And I said, well, podcast aside, like we just need to go see her for our own family. And that was pretty early in our autism journey. And even at this stage, our son does not have an autism diagnosis. He just exhibits lots of autism markers and potential, things that may lead to a diagnosis down the road. And for us, we wanted to make sure that we were giving him full support early on, so that we would really know how much of this was just a purely autism, diagnosis that maybe we couldn't change versus things that we could support and see benefit in before we reached that point of needing a diagnosis or for his education and care. Would you say that seeking out naturopathic support is better as early as possible after we've explored things with our doctors, with therapists? Like where do you think is the best time or place that naturopathic medicine fits in to a care plan?
And that I love that question because, I think, and maybe I'm coming from a biased standpoint, aren't I? Because I'm sitting here thinking, you know what? Well, early, I just think, and this is actually from my original comment, yet earlier the better. And the reason why is because of what I mentioned earlier. If we can intervene at, let's say a child is 6 months old, just starting solid foods, and we want to keep the child's digestive system growing as well as it can with lack of inflammation, with an increase in diversity in their microbiome, because we know in research that that helps the brain to function and grow.
Right.
Well, then we're introducing the correct whole foods, low inflammatory foods into that child's diet to help them thrive. So I'm obviously going into a very specific example. Yet that's one example where you can very early on can see benefits.
And I think that's really an important example because for us, that was the first thing that we adjusted was diet. And we saw almost overnight changes with our child. Having support in that would have made it easier. We were just kind of like stabbing in the dark in the beginning on our own in Dar es Salaam in Tanzania when we first moved here, not knowing where to turn. And so I think that in and of itself, like I know there are lots of examples, but that's such a great one. And it's sometimes overlooked how important that diet piece is.
And Amy, I have to tell you, I think about you and your partner and Zion often, because I think it's fascinating. I think it's like what I theoretically have learned for years, except it kind of gives me goosebumps to know how well you're, you know what? We're going to intervene a little bit here. And this is the path that we're going. And then we see this change overnight. That's not something that we see often. And this is the exact reason why, if it's not you as a parent, which by the way, and maybe I might digress for like one little second here, parents know best. It is wild because parents, you're feeling on your end, you're like, oh my gosh, Hillary, I'm so overwhelmed. I don't know. I'm not certain where to turn. I'm not certain the steps, et cetera, et cetera. And I'm like, okay, I'm here. Let's do this. Yet it's interesting, Amy, because one of my biggest resources are parents with children with autism, because you know so much. So my point is that I just often think about you and your partner being like,
thank you.
We're going to do this. And what
Yeah.
the change that you saw?
Well, it's something that makes us feel so passionate about sharing this message because, you know, I think a lot of parents just think this is what there is. This is what there is for my child. There's nothing I can really do. I can try speech therapy. I can try ABA. I can put them in school one day or whatever. Or they're waiting for, you know, in some provinces, years for assessments, years for doctors, years for therapists. Alberta, you're right, our system's getting overloaded, but at least we have services pretty quickly still. And so that makes me feel passionate about sharing the fact that there's things you can do at home today, right? And when you're able to get that support, you can augment all of those things. But you know, you don't necessarily have to wait for everything. And as parents, like, we have to do the work, do the research. It's hard, but it's there for us. We can do it, you know?
Yes.
Yeah. And that, I really appreciate you saying that. And along those same lines, maybe, you know, I'm saying, like, we have to wait for services sometimes. And I know, like, even naturopathic services, like right now, I love what you were saying about hopefully integrating with AHS one day or working collaboratively with them. You know, naturopathic care isn't free in Alberta. And as far as I know, at this point, it's not covered by AHS at all. So, like, when you look at that cost of care piece and how that fits in with, you know, families that are already maybe stretched or trying to decide, like, where to allocate their money. Like, I believe that naturopathic care is a good place to spend some of that money. But what could you say is like a maybe like why it's such a good investment when we choose to work with a naturopath at this point?
Yes. So it's a tough one, Amy, right? Because I believe so strongly in the power of naturopathic medicine and how it can play a role in a child with autism's life, right? And you're right, it costs money. And so to sort of say this is care that can occur across the entire spectrum, well, I mean, I understand that that's not the case. What I would say is that if they're launching into even thinking about this, initially coming in for an initial appointment, what I would say is just going back to that understanding that the naturopath, or myself, I should say, I keep speaking broadly and I shouldn't, that myself can play a role in understanding the whole person. And really not only just saying, okay, well, here's one thing to Band-Aid, let's say, you know, a symptom, we can say, let's support this entire child. And by supporting all of these pieces, we're going to help them thrive into their adult life. And I know I'm repeating myself, yet I think that's the value right there. The second thing that I would point out in terms of cost and spending money in this area is that there are multiple tests to understand blood work. And I love testing, Amy, in that I love getting some tangible evidence in front of me, showing this to parents and families and saying, this is what we're going to work on. There are phenomenal tests out there, from anything from looking at the gut, and the microbiome in there, and understanding if there's any sort of pathogenic issues, to detox pathways, to understanding if there's anything sitting in the body from a toxin standpoint. There's, like I said, blood work that we can understand, you know, different nutrients and whatnot. So there's multiple tests that are definitely helpful, you know, and just to sort of add to that, yet supplements and nutrients and the different modalities that we use in naturopathic medicine, you know, those cost money and we can do that. However, on the flip side, there are just those lifestyle pieces that we can really talk to because we're working with the whole child. We want to know about their sleep, to their nutrition, to their nervous system, to their family environment, et cetera, et cetera. So it doesn't have to be sort of incredibly overwhelming and costly. And it can be not overwhelming, yet we can spend money and look into things. However, on the flip side, it doesn't necessarily have to be so much.
Yeah, I think what I hear you saying, you can correct me if I'm wrong, but just because there are all of these things doesn't mean we necessarily have to do them all to see some sort of result. So even with naturopathic medicine, it can work within a budget, or maybe there are just natural things that you can do at home and it's sound advice. And which actually is something else I wanted to ask you about, because so as a parent who loves learning and researching and reading and watching stuff, of course, social media is going to play a huge role in all the things that we see, because as soon as you start searching for any of this, your whole feed becomes about whatever, autism, natural treatments or causes or whatever. So I know I see every kind of reel right now, every kind of TikTok right now, like doctors, therapists, parents, even just sharing their lifestyle or how they manage things. MLM salespeople that are selling like detoxes at home, encouraging you to pump things in the mouth of your 2-year-old or 3-year-old, oils, books, recipes, all kinds of things. Everybody's selling something. There are a million resources. And as a parent, it's hard. And honestly, this was probably the number one reason why our family finally said enough. We came to see you, because there was so much information hitting us. And we were like, we want to try it all, but we want to try it safely. We want to make sure we're not harming. We want to make sure we try things in the right order, right? So like from your perspective, and parents getting this like overhaul of information all the time, like how do we know who to trust, what voices to listen to, who are good resources for us online? I know that's a huge question. There's probably hundreds and thousands of great resources, but just generally speaking, like how do we know who to trust, who to listen to?
Yeah, I think with respect to social media, once you get into, and I'm being very specific to social media yet, once you get into let's say a person that you follow, then you dig in, right? What are credentials? What's their history? And that's not to say, to be clear, that that I'm talking about qualified credentials like a medical background. I mean, yes, that would be absolutely helpful, and you definitely want that. Yet, let's say this is a parent that has been on their journey with their child with autism for years, and they're sharing what has worked with, like, for this specific child. They are probably an expert as well. So, and that's your judgment. That's sort of for you to be like, okay, I actually really understand what's going on here, and this resonates with me. And so my point is I'm not saying it's just only strictly medical professionals that you need to listen to or adhere to. Yet, A, if you looking at credentials, B, really understanding who you're listening to and really kind of dig into what's going on, not just sort of say like, my goodness, I've seen this ad, let's try it. The last thing is that using your naturopath as a resource to say, hey, I found this, and this. I'm really interested in this. I'm really thinking that this would resonate with my child. I'm not sure, obviously. And I'm listening to this and I'm hearing this. What is the correct brand of, let's say, a nutrient supplement?
Yes.
What's the correct dosage? What's the quality? How do I use this? And then it can be like, add this one in, then do this, and actually definitely don't touch this one, right? Because then it can be like a whole treatment plan, as opposed to, I'll have patients come in often on multiple supplements, right? Here is our laundry list of supplements we're giving. And one of the things or most important parts is to unravel sometimes, all the supplements that are maybe not in activated forms or correct dosages. Say, okay, move this to this dosage, get rid of this one, finish this off, start this one, and really kind of navigating through what they're doing already and saying what is working and what's not.
Right.
Yeah.
Yeah, because I think there's real value in adding things slowly, assessment as you go, and having somebody, I mean, as a parent, it's hard day to day to to monitor every little thing, to watch everything we try, right? But it's overwhelming. And so having somebody on your team to kind of say, okay, let's do this now. In a month, let's add this and see, that's so valuable to have somebody kind of leading you on that path instead of just, and as parents, I think, we look at our little ones and we just want the best for them. We want to throw everything we can at making them as healthy as possible. And especially if they're not communicating and they're frustrated or they're showing stims that are dangerous for them, or their digestion's a mess and every day is a struggle, or they're not eating. Like all of those things can be so hard on a parent. So we just want the best for them, and sometimes I think we get a little ahead of ourselves trying everything under the sun. And so I feel like having somebody on your team and just kind of walking with you is invaluable. I think that's such a great advice. And yes, you're right about looking at credentials, but also looking at anecdotal advice, because parents out there have stumbled across incredible things, right? I've bought resources from parents who are just parents, like because I see their stories and I'm moved by their stories, and I want to see what they're doing well. And we've been able to implement things like that too.
Yes. And I do feel like, Amy, on that note, what you're saying is that when you begin your journey, I think, and to be honest, actually, I'm thinking about this one patient that just, I feel I hold so close to my heart. At the very beginning, there was a regression as opposed to, I wonder if this has always just been this way in terms of the symptoms that were showing up for this child. And they're sort of caught in grieving, right? And that makes so much sense. My heart even sort of drops when I even talk about it right now, right? However, what I've slowly started to encourage here is the community, because I feel like just what you're saying, not only for, okay, they've tried this family's tried this, but maybe try this. It's not just that piece. It's also that I do feel strongly about supporting the family and community, like a person or a family who knows how you feel to the bone, like to the core of them, is so incredibly nurturing for people. And community, I think we're humans. We need that community. And I think that's another reason why, reaching out or understanding, whether it be online, whether it be in person, I think both are so incredibly powerful. Does that make sense?
It really does. And I can attest to that. Like when we come to see you, like we feel that, it's not just you ask about us, like, and as a family, it's not even just parents, as siblings, as grandparents, as support systems, as even babysitters, like, or people coming into your home to help, therapists, that kind of thing. Like it affects us all. I think last night my son was awake for 3 hours in the middle of the night, just poking my eyes and playing with my hair. These are the things that we do as parents, and having somebody that truly understands that is invaluable.
One, I do feel like, and we just touched on it, is building that community. I think is really important for parents. I think taking care and nurturing the parent, as well as even maybe getting their own support. I think that's so huge, because you are the child's environment all the time. Another kind of key message or something I feel passionate about is that this is very much, or can be, a very step-by-step process of discovering, understanding, testing, which, you and I spoke about already, or not. And then really and understanding the child as a whole, and then treating, quote unquote, and taking the time and the getting your team around you to create that step by step with you, and meeting you as a family, but however, meeting the child where they're at. So I feel like maybe those are a few things that I would kind of leave the message, or leave as a good key message.
Yeah, and that really speaks to your heart and how you look at families, and it's not just a in the door, out the door. We just really appreciate that so much. And everything that you shared today, it's so helpful to families to understand some of these things, to hear the voice of professionals without, having all of this background noise. So I just appreciate so much you taking the time to come on the podcast and be part of really helping Alberta families. And, this is a crazy but beautiful, but often confusing journey. And so having people like you willing to spend your time with us is just really special. I appreciate it so much. So thank you so much for being here. It's really good of you.
You're welcome, Amy. And I very much love being here. I appreciate the invitation, and I feel so passionate about children with autism that I could talk about it for hours. So, yeah, I'm happy to be here. So thank you.
Well, thank you again. I hope you have a great day at work, and I'm sure we'll talk to you soon.
Okay. Sounds good.
All right.
Thanks, Amy.
Thanks, Hillary. Thank you for listening to this episode of Autism Compass. We are honored to have you with us. You can read our informative blog, search past episodes, and find even more helpful resources at autismcompass.ca, or search for us on Instagram and Facebook at Autism Compass. Let's navigate childhood autism side by side.